Hello, my name is Alejandra Gloria. My topic is non-wire localization methods, revolutionizing breast cancer with advanced imaging. To begin with my abstract, breast cancer is the most commonly diagnosed type of cancer and second highest cause of cancer deaths in women. The majority of these cancers found are not palpable, requiring the use of a localization procedure for removal. As breast cancer conservation therapy has become the standard of treatment, the number of localization options has also increased. While traditional wire localization has been the standard of care for removal of non-palpable breast lesions, non-wire localization methods have significantly developed in the last decade. 3 non-wire localization methods, SavvyScout localization, radioactive seed localization, and MagSeed were examined in comparison to traditional wire localization. Benefits, surgical outcomes, and limitations to each method were reviewed in an effort to determine if one method is superior to the others for breast cancer conservation therapy. Introduction. Approximately 250,000 women are diagnosed with breast cancer each year, and nearly 40,000 die from this disease. Non-palpable breast cancers make up approximately 25 to 35% of breast cancers. The first non-wire localization was performed in 1963 with the patient supine and the needle was taped to the patient's skin to prevent dislodgement. Over the years, the method has developed and multiple non-wire localization methods are now available. These non-wire localization methods include SavvyScout reflectors, radioactive seeds, and MagSeeds. Image-guided excision of malignant and benign lesions have become very common. A safe and economical technique to these procedures is critical to women's health. While wire localization has been used for nearly 40 years, this technique has associated with procedural, scheduling, and outcome challenges. Evaluation of alternative breast localization methods has been performed to identify if there is a superior method to the traditional wire localization. Methods. A search of current trends in radiologic sciences was conducted on Google. Searches were later specified to current trends in mammography. Research was focused on non-wire localization of breast cancer, specifically SavvyScout reflectors. The Midwestern State University Moffitt Library research databases were utilized. Keywords used in the search were SavvyScout, SavvyScout versus wire localization, and non-wire localization and imaging. 8 articles were selected from Medline Complete and Signal Complete based on content and current relevancy. A synthesis matrix was used to establish common themes, which included localization methods, benefits of non-wire localization, surgical outcomes, and limitations of non-wire localization methods. Discussion. Wire localization, introduced in the 1970s, is performed using image guidance to place a thin hooked wire into a breast lesion with the guide protruding through the skin. The wire protruding carries the risk of potential dislodgement. Wire localization must be performed the same day as surgery, which can lead to potential delays within the surgical or radiology departments. SavvyScout reflectors are completely implantable devices that can be placed up to 30 days before surgery. SavvyScout reflectors are 12mm fiducial reflectors placed under image guidance, and a handpiece system is used to localize the reflector to remove the breast lesion. Surgical outcomes reported by Berkovici and Tingen reflected lower positive margins in SavvyScout reflectors to traditional wire localization. Limitations to SavvyScout reflectors include the inability to be repositioned once they are deployed, and the potential for the reflector to be disabled by electrocautery equipment. Radioactive seed localization utilizes a titanium seed containing iodine-125 placed under imaging guidance. Radioactive seed localization can be placed up to 5 days prior to surgery, allowing for flexibility in scheduling for both surgery and radiology departments. In studies performed by Chagbar, Patel, and Schroer, there were little difference in positive margins between the non-wire localization methods to the wire localization methods. Radioactive seed localization requires additional administrative oversight by the Institute's radiation safety officer. Establishment of the program takes approximately 9 months. Each seed must be tracked, recovered, and properly disposed of. If lost, could result in loss of nuclear regulatory licensing. Mag seed localization contains a 1 mm by 5 mm magnetic seed that is also placed under imaging guidance and can be placed up to 30 days prior to surgery. The mag seed uses a Centimag probe that detects the magnetic signature of the seed to locate the breast lesion. Mag seeds require the use of special non-ferromagnetic surgical instruments because ferromagnetic instruments will interfere with the device's signal. If interference occurs, recalibration of the probe is required. Below, I have included images of both a Savvy Scout reflector and a mag seed detector. To the left is the Savvy Scout reflector, and it has the device used to detect the reflector, and it does have a size comparison to a dime to show how small the reflector is. To the right is the mag seed, again the device used to detect the detector, and then again shows the size in comparison to a penny for this device. Conclusions and future research. Breast conservation therapy has become the standard in breast cancer treatment. As techniques have evolved, a variety of non-wire localization methods are now available for non-palpable breast lesion localization. Savvy Scout reflectors, radioactive seeds, and mag seed localization devices each have their advantages. Positive surgical outcomes, improved cosmesis, patient comfort, efficiency in scheduling and workflow supports the advancement in each of these methods. Each method has its limitations, making no superior choice over the others. Choice is usually decided based on facility and surgeon preference. Growth and research in breast conservation therapy creates great opportunities for breast cancer patients. The use of traditional wire localization for the use of non-wire localization methods gives options to patients of all circumstances. These advances allow for exceptional patient care. Future research focused on the cost and patient experience could contribute to personalized, patient-centered localization techniques for breast conservation therapy. Lastly, I would like to bounce back to the images I have in the middle of my poster. The image on the far left is an example of a traditional wire localization. It shows the wire protruding from the patient's breast. The two images that follow demonstrate a Savvy Scout reflector that have been placed in the breast. They're small reflectors that do not protrude the skin, and as stated previously, they can be placed days prior to surgery versus the day of, as in traditional wire localization. I have listed a reference list to the right, and that will conclude my presentation. Thank you so much.